Good evening. Tonight I want to have a very direct conversation with you. Not a gentle one, a direct one. Because after more than 2 decades working with adults over 65, I have watched too many people lose their independence, their mobility, their cognitive sharpness, and in some cases their lives, not because of unavoidable disease, not because of bad genetics, but because of specific, entirely preventable habits and behaviors that they simply never realized were quietly doing them serious harm. I'm Dr. Will Graham, and tonight I'm going to walk you through 5 things that adults over 65 continue doing regularly that the research clearly shows are significantly accelerating their physical and cognitive decline. Some of these will surprise you. Some may make you uncomfortable. That is entirely intentional because comfortable conversations rarely change anything. I want to be honest with you up front. This is not a video about rare exotic risks. Every single thing on this list is something I see regularly in my patients, ordinary, intelligent, well-meaning people who simply didn't have this information presented to them clearly enough, early enough to make a different choice. Tonight, I'm giving you that opportunity. A comprehensive study published in the journal Age and Aging, following over 5,000 adults between the ages of 65 and 85 across an 8-year period, found that specific modifiable lifestyle behaviors were responsible for an estimated 40% of the functional decline observed in that population over the study period. 40% of the decline these adults experienced was not inevitable. It was driven by things within their control. That number both troubles me and genuinely encourages me because it means that a meaningful portion of what people accept as unavoidable aging is actually modifiable if they have the right information at the right time. Stay with me through all 5 because the final one is something I suspect the majority of people watching tonight are doing right now, today, and it may be doing more damage to your long-term brain health than almost anything else on this list. Before we get into it, drop a comment below and tell me your age and which of these 5 you suspect you might be doing. I read every single comment on this channel, and I respond to as many as I genuinely can. Your honesty down there might be exactly what helps someone else make a change tonight. All right, let's count down from 5 to 1. Number 5. Taking pain medications, including over-the-counter options, regularly without physician guidance. This is the behavior I encounter most frequently, and it's also the one that generates the most resistance when I raise it, because the medications involved feel familiar, accessible, and safe precisely because they're available without a prescription. I'm talking specifically about regular, long-term use of non-steroidal anti-inflammatory drugs, commonly called NSAIDs, including ibuprofen and naproxen, and to a lesser extent, acetaminophen, for managing chronic pain without regular physician oversight. Here is why this is particularly dangerous specifically after 65. Your kidneys, as we discussed in a previous video, become less efficient with age, filtering roughly 40% less blood per minute at age 75 than they did at age 35. NSAIDs work in part by affecting blood flow regulation in your kidneys, and in younger adults with robust kidney function, occasional use is generally well tolerated. But in older adults with already reduced kidney reserve, regular NSAID use can progressively damage kidney tissue, sometimes causing a measurable decline in kidney function that accumulates silently over months and years before it's detected on routine blood work. Research published in the American Journal of Kidney Diseases found that regular NSAID use in adults over 65, defined as use more than 3 times per week for more than 3 months, was associated with a significantly accelerated rate of kidney function decline compared to non-users in the same age group, even at standard over-the-counter doses. Beyond kidneys, regular NSAID use in older adults increases the risk of gastrointestinal bleeding, which is significantly more dangerous in older adults than in younger populations, and has been associated in multiple studies with elevated cardiovascular risk, including increased risk of heart attack and stroke with prolonged use. Acetaminophen, while generally considered safer for kidneys and the gastrointestinal tract than NSAIDs, carries its own concern in older adults when taken regularly and in combination with other medications, particularly any medication processed by the liver, including many common blood pressure, cholesterol, and diabetes drugs. The threshold between therapeutic and hepatotoxic doses of acetaminophen becomes narrower in older adults with any degree of reduced liver function. None of this means that pain management is unimportant. Chronic pain is real, it significantly impairs quality of life, and it absolutely deserves proper treatment. What it means is that regular, long-term pain medication use in adults over 65 deserves physician supervision, not simply a habitual trip to the pharmacy because it worked reasonably well last month. There are safer, highly effective alternatives for many types of chronic pain in older adults, including physical therapy approaches, topical treatments, and specific exercise regimens shown in research to reduce pain levels over time that your physician can discuss with you in the context of your complete health picture. Number 4. Skipping meals, significantly restricting calories, or following extreme elimination diets in an attempt to lose weight. This behavior stems from genuinely good intentions, wanting to be healthier, wanting to maintain a healthy weight, wanting to reduce the burden on aging joints. I understand and respect those motivations completely. But the physiological reality of caloric restriction and extreme dietary elimination after 65 is fundamentally different from what those same approaches produce in a 40-year-old, and the difference is not minor. Here is the core issue. After 65, and especially after 70, your body's ability to maintain muscle mass becomes increasingly fragile. We discussed anabolic resistance in our protein video, the reduced ability of aging muscle cells to respond to protein and exercise stimulation. In this context, caloric restriction or meal skipping creates a significant problem. When you don't consume enough total calories, your body begins breaking down muscle tissue as an energy source, a process called muscle catabolism. And in older adults, this muscle loss occurs far more rapidly and is far more difficult to reverse than in younger adults. Research published in the American Journal of Clinical Nutrition found that older adults following calorie-restricted diets without deliberate resistance exercise and high protein intake lost a disproportionate amount of lean muscle mass compared to fat tissue, a pattern called sarcopenic obesity, where body fat percentage actually increases relative to muscle even as overall weight decreases. This is the opposite of the health outcome these individuals were seeking. They were losing the tissue that protects them from falls, maintains their metabolism, and supports their independence, while retaining the adipose tissue driving their health concerns. Beyond muscle loss, severe caloric restriction in older adults can impair immune function, reduce bone density through inadequate calcium and vitamin D intake, and worsen the nutrient deficiencies we've discussed across multiple videos on this channel. A 69-year-old retired accountant came to see me after following an aggressive calorie restriction plan for 5 months. She had lost 14 pounds, which sounds like a success until blood work revealed she had lost primarily lean mass, her grip strength had declined measurably, her albumin was low, and her B12 and magnesium levels had dropped significantly. She had achieved a number on the scale at the direct expense of the biological infrastructure supporting her independence. If you are over 65 and want to improve your body composition and metabolic health, the research points clearly toward a combination of increased quality protein intake, twice-weekly resistance training, and moderate overall dietary improvement focused on whole foods and reduced processed food consumption, not aggressive caloric restriction or elimination dieting. This approach protects and builds muscle while allowing gradual, sustainable fat reduction in a way that actually improves long-term health outcomes rather than undermining them. Number 3. Sitting for more than 8 consecutive hours daily without deliberate movement breaks. This one is particularly important in the current era, where television streaming, computer use, and reduced physical confidence among older adults have combined to create what researchers call sedentary behavior, prolonged, uninterrupted sitting that goes beyond simply being physically inactive. And the distinction between being generally inactive and engaging in prolonged, uninterrupted sitting matters more than most people realize. Here's why. Research from the University of Leicester, published in the journal Diabetologia, found that prolonged uninterrupted sitting, independent of overall physical activity levels, was associated with significantly elevated inflammatory markers, worsened insulin sensitivity, and measurably increased cardiovascular risk. Critically, this research found that breaking up sitting time with brief movement every 30 minutes, even just standing and walking to another room for 2 to 3 minutes, significantly attenuated these negative effects compared to unbroken sitting of the same total duration. For adults over 65, the specific concern is compounded. Prolonged sitting accelerates the muscle deconditioning we discussed earlier, contributes to the venous pooling in lower legs we covered in our heart failure video, and has been independently associated with accelerated cognitive decline in research published in PLOS1, which found that older adults reporting the highest daily sitting time showed measurably thinner cortical regions of the brain associated with memory and cognition on MRI imaging compared to those who broke up their sitting regularly throughout the day. The practical prescription here is beautifully simple. Set a timer for every 30 minutes during waking hours. When it goes off, stand up, walk to another room, do 5 chair squats, march in place for 2 minutes, whatever feels manageable. The research does not require vigorous exercise to produce meaningful benefit. It requires breaking the uninterrupted sitting pattern consistently throughout the day. That alone, applied consistently, has been shown to reduce inflammatory markers, improve blood sugar regulation, and support cognitive health in ways that genuinely matter over the long term. Quick note here, if this information is proving valuable, take a moment to subscribe to this channel because every week I bring you exactly this kind of research-backed, practically applicable health information specifically for adults over 65. Number 2. Dismissing or delaying sleep problems without seeking proper evaluation. We have covered sleep extensively on this channel in previous videos, discussing its relationship to Alzheimer's risk, cognitive decline, cardiovascular health, and immune function. I bring it up again tonight in this specific context because the behavior I'm targeting here is not simply sleeping poorly. It is the active dismissal of sleep problems as an inevitable, unimportant part of aging that doesn't warrant proper medical attention. I have watched this pattern cause genuine, measurable harm repeatedly. A patient mentions waking 4 times a night and is told by a well-meaning family member or even a physician that this is simply what sleep looks like after 70. They accept it. They adapt around it. And meanwhile, years pass during which their brain is accumulating amyloid plaques faster than it should because the glymphatic clearance we discussed in our sleep video isn't completing its overnight work. Their inflammatory markers climb, their cortisol regulation deteriorates, their fall risk quietly increases as sleep deprivation progressively impairs balance and reaction time. Research published in the journal Nature Aging found that consistently sleeping less than 6 hours per night in adults over 65 was associated with a 30% higher risk of developing multiple chronic conditions simultaneously compared to those sleeping 7 to 8 hours, including cardiovascular disease, type 2 diabetes, and cognitive impairment, with risk compounding significantly when poor sleep persisted for more than 2 years without intervention. Here is what makes this particularly important. Many causes of poor sleep in older adults are genuinely, specifically treatable. Sleep apnea, which becomes increasingly common with age, is often completely undiagnosed in older adults because it presents differently than in younger patients, frequently without the dramatic snoring patterns that prompt investigation in middle-aged adults. Restless leg syndrome, certain medication effects, thyroid dysfunction, pain, and treatable mood disorders all represent correctable contributors to poor sleep that deserve proper evaluation rather than indefinite acceptance. If you are regularly sleeping fewer than 6 hours, waking more than twice nightly, or consistently waking unrefreshed regardless of hours slept, this is not a complaint to dismiss. This is a medical concern that deserves a specific, thorough conversation with your physician, including a review of your current medications and a discussion of whether sleep study evaluation is appropriate for your situation. And now, number 1, withdrawing from mentally challenging activities and allowing your daily routine to become comfortable, predictable, and cognitively unstimulating. This is the behavior I consider most damaging of all 5, and it is by far the most common pattern I observe among adults who come to me in their mid to late 70s with accelerating cognitive decline that, upon careful history taking, turns out to have begun with a very specific turning point: retirement, the loss of a spouse, a move to a new home, a health scare that reduced confidence, any life transition that prompted a retreat into a narrower, more comfortable, less cognitively demanding daily routine. Here is the biological reality. Your brain is not a passive organ that declines on a fixed schedule regardless of how you use it. It is an extraordinarily dynamic structure that responds, for better or worse, to the demands you place on it. When those demands are reduced, when your days become predictable, when you no longer regularly encounter problems to solve, skills to learn, conversations that challenge your thinking, or situations that require you to adapt, your brain responds by reducing its investment in maintaining neural connections that are no longer being regularly used. This is called synaptic pruning, And while it's a normal biological efficiency mechanism, in older adults, it can accelerate the depletion of cognitive reserve, the brain's resilience buffer against age-related structural changes, in ways that have real, measurable consequences over time. A landmark study from the Rush Memory and Aging Project, following over 1,600 older adults across more than a decade, found that those who described their daily lives as cognitively engaging, involving regular learning, problem solving, and mentally demanding activities, showed a rate of cognitive decline approximately 32% slower than those whose daily lives had become primarily routine and unstimulating, even after controlling for baseline cognitive ability, education level, and physical health status. The brain you challenge regularly is measurably more resilient than the brain you allow to coast. What concerns me most in clinical practice is how gradual and self-reinforcing this withdrawal tends to be. A person retires and loses the daily cognitive structure and social intellectual engagement that work provided. They begin filling time with less demanding activities. Those activities become habits. The habits become the entirety of the daily routine. And within a few years, the cognitive contrast between the engaged, challenged brain of their working life and the comfortable, unstimulating routine of their retirement years has created a deficit in cognitive reserve that begins showing up in measurable ways: difficulty following complex conversations, slower word retrieval, reduced ability to manage multiple tasks simultaneously, all of which gets attributed to aging when in reality it was substantially driven by a decade of insufficient cognitive demand. The research on reversing this pattern is genuinely encouraging, and we've covered it in detail in our cognitive challenge video. Learning a new skill, studying a new language, taking on voluntary roles that involve problem solving and social engagement, joining groups that involve debate and intellectual exchange, all of these have been shown in multiple studies to measurably improve cognitive reserve and slow decline even when begun in the mid to late 70s. The brain retains genuine plasticity well into advanced age, but only if you give it sufficient reason to exercise it. If your days have become comfortable, predictable, and free of meaningful challenge, I want to ask you directly and respectfully, is that comfort worth trading for the cognitive sharpness and independence that mental engagement helps preserve? Because the research is clear that the two are connected in ways that matter enormously for the years ahead of you. Here is your practical starting point. Tomorrow, choose one thing that genuinely challenges you, something you don't already know how to do well, something that will make you feel slightly uncomfortable and slightly uncertain, and begin. Not next week, tomorrow. Because the research on cognitive reserve doesn't suggest that starting later produces the same outcome as starting now. All of the research referenced tonight from the journal Age and Aging, the American Journal of Kidney Diseases, the American Journal of Clinical Nutrition, the University of Leicester research published in Diabetologia, PLOS One, Nature Aging, and the Rush Memory and Aging Project are linked in the description below. I encourage you to read them, share them with people you care about, and bring specific questions to your next medical appointment based on what you've heard tonight. If you found this video valuable, please subscribe to this channel because every week I bring you exactly this kind of direct, research-backed, practically relevant health information specifically for adults over 65. The kind of honest conversation that busy appointments too rarely make room for. Now I want to hear directly from you. Tell me in the comments which of these 5 behaviors you recognized in yourself and what one specific change you're willing to commit to making starting tomorrow. I read every single comment, and your commitment stated publicly down there may be exactly the accountability that makes the difference between meaning to change and actually changing. Take good care of yourself. You have more control over how the years ahead unfold than you may currently believe. Use it. I'll see you in the next one.